Welcome to the Sustainable Clinical Medicine Podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Welcome back, everybody. We are here with Jennifer George, who is also in Canada and is a physical therapist. I am going to get you to introduce yourself and welcome.
Thank you. Thank you so much for having me, Sarah. I mean, I've looked at your past guests, I've listened in, and I'm quite honored to be invited to your show. So thank you for doing what you're doing in the space and inviting me here. So a little bit about myself.
Yeah, about you.
I'm so good at deflecting. Okay. So I'm a physiotherapist. I work currently on an inpatient rehab unit at a local hospital here in Windsor, Ontario. I've been where I'm at for the last 10 plus years, but overall I've been practicing for over 15 years. And, I got into physiotherapy really because, I was inspired by the profession when I was probably as far back as high school. So I myself had a health transformation, a personal and physical health transformation. And at that time I was in my senior year of high school and was considering going to university, having to apply and kind of think of the areas to focus, right, and apply to. And at that time, I thought I was going to get into pharmacy, biochem, women's studies, psychology. Those were the areas I was looking at. And then, during my transformation, when I became more fit, more healthy, I had lost some weight. I was always active. And at that time, I had kind of a stress response in high school. It wasn't so easy back then. And I think I put on quite a bit of weight, didn't feel comfortable in my own skin, had the foresight to recognize that, thankfully, and, kind of turn my health around back then. So at that point, I was engaged in a fitness class and ended up taking that in my senior year and ended up winning, the Human Kinetics Book Award for the University of Windsor. Had no idea what human kinetics was at that time. And once I read up on what it was, I was like, oh, this is exactly what I would want to do. It's the science of human movement and helping others through physical movement, basically, and, the analysis of body movement. So I then switched my application to that. I was able to do that and enrolled at the University of Windsor, finished top 3 in my class there, and was strongly encouraged to go into medicine, actually. And I just knew it wasn't for me. I understood back then, the responsibilities of a physician. You're on call a lot. Like, I didn't think it was the kind of lifestyle that I wanted to lead. So I learned more about physiotherapy, again, kind of aligning with, the human body and, physical rehab and activity and helping people to kind of empower themselves and get back to movement again and enrich their lives that way. And so that spoke to me more. And that is kind of how I ended up in the field. So in the program. So I went to Western, did my master's there for a couple of years and moved back home to practice.
Perfect. About your physical therapy journey, when you were in senior years at high school, you said that you had, was it the dedication to the studies that had created some of that change in your physical fitness? What had...
No, it was more, I always had an interest in the sciences. That was something I always was interested in. But truly for me, like growing up, I was very physically active. I was quite a tomboy, so to speak. Could keep up with all the neighborhood boys and, kind of outplay them in ways. And then I got into high school, and high school was kind of a struggle for me socially, and put on weight. And I just literally did not feel at one point comfortable in my skin anymore. I was still participating in sports, but I just within me didn't feel like myself. And so, I weighed myself at the time, saw that I was, almost 190 pounds. I'm 5'3". And I didn't realize that, I had put on weight in a way, didn't really weigh myself much. Just knew I wasn't comfortable with myself. I mean, that was kind of where I started. And so it wasn't so much influenced by my studies, but then when I took that fitness class, because I had already started that journey, I became more engaged, and I've been to the gym ever since, since my high school years. So I was very lucky back then to have been exposed to that. And so it kind of came from an internal place. And then I realized externally what was around me to further support that, and maybe other people in my shoes too, that would be my shoes at some point in their lives.
Yeah, I'm interested in this fitness class. What do you think it was? Because I know a lot of the time you might, in that very vulnerable age, step on the scale and kind of have a crisis, and then a shaming and guilting and doing things in a way that is not a sustainable way. But you actually created a practice that's lasted.
Hmm. Yeah, that's true. I mean, so that weight, I've kept off ever since. I've always just been very committed to my own personal health, I guess you could say, and my own fitness. I really enjoyed, like, the process of working out, of getting fit, because I'd always just been physically active through sports, right, recreationally, and never really had much experience within the gym itself. So I learned a lot about, lifting and programming and, cardiovascular exercise and all of that back then. And I was very dedicated to it, and just kind of, indulged in it. And I think that was why I was nominated for the award. It wasn't so much about my transformation. I think it was my passion for it that spoke to the instructor and the teacher at that time.
Yeah, it sounds like it's very influential. Tell us
Yeah.
about physical therapy. Was it what you had dreamt it would be? Like, what did you find along your journey there?
Um, so yeah, so I got into physio school, and physio school was quite um, challenging. I remember, my first, and I'm sure it was, for med school too, right? Like, when I first got there, I was like, I can't do this. Like, it was just so much in such a little period of time that was so crammed. I remember calling my dad saying, I can't do this, and he was like, come home right now, I'll come pick you up. He was being so supportive in that way. But really, I just learned to manage my time in school. Over time, I just had to kind of navigate that, and rely on the connections I had in school as well to get us through, because we were all going through the same thing. But really, in school itself, it was more just learning the technique of physiotherapy, the skills that we had to acquire to objectively assess and treat and educate our patients, right? And when I got into practice, that's the way I thought it was going to be. It was going to be just the practice of it, right? And then I started at, the school I went to was wonderful. It was very ortho dominant. So I went into, the private clinic space, essentially. I did a little bit of hospital, covered a short mat leave there, and then did a bit of private clinic for a couple of years. And I liked it. I didn't love it, but I did like it. And then I realized that, that there was a bigger framework at play here. When you're in school, you don't learn about the healthcare system. You don't learn about how to sustain your own well-being to get through the challenging times that you'll inevitably experience as a healthcare provider. And so I started to experience that, where I was, in positions where I was kind of encouraged to see more patients, for instance, more than I could sustain, right? And I found that very challenging to navigate. In fact, I found it became toxic at times, because I didn't know how to have those conversations, with my superiors at that time. I just felt like the focus was more on profit and not on quality or patient care. And I was relatively a newer grad. I was within my first 5 years of practice. So I found those first 5 years kind of challenging, for sure, from that standpoint, in terms of, giving patients the care, the quality care that they needed, which was the care that I always imagined being in school, and kind of the way I was, I don't want to say led to believe, but the way I was kind of felt to believe it would be, right? From my schooling, and just from the, my passion for helping others.
Yeah,
So,
that's
yeah.
that's interesting reflection. We hear that a lot in within physicians, within other allied health as well, within clinicians, saying this isn't how I wanted it to be. This isn't what I would choose in terms of the quality or time I can spend with the patient. And it creates sometimes medical trauma. Like we actually see that where the physician or clinician is feeling a response to the way they're being asked to practice. And I noticed that you called it toxic. Tell me more about what did that mean for you? What was toxic? What
I
did that
just
feel like?
I just didn't feel clinically supported. Yes, there, in that regard, I didn't feel like people were understanding where I was coming from. But I also felt like I also didn't know how to navigate those conversations back then. That was I was also contributing to that too, by not understanding that what I was feeling was reasonable, and how to kind of present that in a way that would be better received by my manager at the time. So I think that was definitely partly me contributing as well. But I do think that there wasn't really a recognition of the bigger picture of quality patient care. I understand the business is a business, but I just kind of felt like I was forcing myself to fit into a framework that just, I think, within my values just wasn't really aligning. And I think when you're put in those situations, you can only, experience that type of resistance for so long before it starts to kind of creep into everything. So yeah, it wasn't a workplace I wanted to go to really anymore. That's kind of probably my biggest indicator. I wasn't really inspired to bring students into the practice because I didn't want to see, I didn't want them to see this, right? And have their outlook be based on that.
Yeah. During school for physical therapy, was there much education about the business side of running a private physical therapy practice or any mentoring about how seeing patients might look within a private versus hospital system?
No, not at all. And I had experience in both. Like I was a student at a private clinic and I was a student in hospital as well. And I never got exposure to that. I could see how busy things were, but when you're a student, you're not the primary, right? So it's different. But I know when I have students in my practice, I tend to give them more independence because I really want them to be aware of what their role is going to be in this greater system and where they're going to feel like they can add value the most. I had wonderful mentors along the way, don't get me
Mm-hmm.
wrong, but I think as they were encouraged to do was, the focus was mainly on my technical skills and my knowledge, right? And I think that's kind of what you're basically being evaluated on more than anything.
Yeah. When you were in that place of being asked to see more and more patients within the time, I guess,
Mm-hmm.
what happened to you? So how would that day go? Would it be contained to the clinical day? What did it mean to be able to see that number of patients?
So for me, it meant like charting through my lunch, not really taking breaks. It meant staying later and charting. I don't do this anymore, but sometimes it meant bringing work home. So not really having a boundary, I think, was kind of how it was, and just trying to keep up essentially. And then, I didn't really have full control over my schedule in a way. Like, we had a front desk staff that kind of had more control over the schedule. And again, that was another thing I didn't know that I could have more control over that, right? So I do think I took more of a passive approach, not knowing at the beginning of my practice. I was more about just trying to make a good impression and trying to, be a good employee and not realizing that I actually have more autonomy and I could have more autonomy than I actually felt I did.
Yeah. Do you think that you could have reasonably negotiated for something that was closer to what you wanted? Or do you think that this model, this clinic was looking for someone who could get this number of patients seen in a day?
I think that was the clinic's model back then, and I just don't think they were also aware of that as well in terms of other options that could have been had. Right? I mean, I do think that looking back, if I was in that position today, you don't know until you've had the experience. I think, but I would negotiate things differently for sure to
Yeah.
sustain it. Yeah.
What sort of toll was it taking on you personally within your, like if you're taking work home, you're staying later to finish this day off, what was that costing you?
I just felt like for me, I was just chronically stressed. I felt like I was always on the go. I felt like I was always rushed. I remember like going to work one day, driving into work, and I made a rolling stop, right? And I was pulled over. And I remember thinking, like, I literally only live 5 minutes away from my work, and yet I'm rushing to, you know what I'm saying? And I just felt like I was constantly on the go. There was no sense of peace, no sense of stillness, no sense of those micro breaks even in a way. And then when you bring that work home, you kind of, your patience only can last so long. So I find, I just wanted to be more isolated, didn't socialize as much, at that time I was living, I had moved back home with my parents. My dad came home from hospital, so I moved back home to help my mom care for him. So I was a caregiver at the time as well. And so, I was in the service of, my dad, but also of my patients. So I just kind of felt like that's all I was doing in a way. So my patients did vary as well. And like I said, I kind of wanted to isolate myself sometimes and not talk about things and have conversations because I just needed to decompress, if that
Mm.
makes sense. And I think a lot of providers go through that. I've heard, in my own personal conversations with people that, sometimes they get home and, they're arguing with their family members or they're not talking to them at all because it all kind of just comes out at home, right? You maintain
Yeah.
everything at work and then it's gonna spill over somewhere at some point, right?
Yeah. And even that guilt of you're now adding this another layer of I can't hold it together anymore.
Yes.
Guilt. Hmm.
Yeah, absolutely. And I think too, like, I was working in an outpatient ortho clinic, very generalized, right? So kind of saw everything, a little bit of everything, a little bit of neuro, a little bit of ortho, like it was just very diverse. And I think, again, not knowing it, but that was really wasn't where my passion was either as a physio. Where I'm at now clinically is what I love doing. And now I know that. So I think that you sometimes have to go through these things. But what I think is important is to be mindfully aware of how you're feeling throughout and, asking yourself, is this sustainable? Is this really, what I want to be doing? And is where I am really where I want to be right now? So
How did you get to that point of wanting something different and going looking for it? What did that journey and transition look like?
So that's a good question. So I worked a couple years at that private clinic. It then closed down, and and looking back, part of me thinks, if it didn't close down, would I still be there, right? Like, because you don't know what you don't know, right? So when it closed down, I did make the decision not to. They were reopening somewhere else, and I made the decision not to pursue that. Um, and then my previous mentor in physio actually was in long-term care at the time. And she had encouraged me to look at long-term care. And I thought, I can't do long-term care. Like I'm in an outpatient ortho clinic to long-term care, ignorantly. I thought that, I wouldn't be fulfilled in doing that. So I did long-term care for a few years while also running like a workplace wellness for staff, which was kind of cool as well. So I still got to do some ortho stuff. But I actually loved long-term care and I learned a lot in long-term care. I learned a lot about integrated team approaches and restorative care and communication, learned a lot there. And then the OHIP model changed in long-term care. And so then my full-time workload would be divided. I was already working between two different homes. So then I realized my workload would be divided between like, I think 3 different homes to make it a full-time schedule. And I just, again, it was also becoming a little bit like the clinic where they wanted us to see more people. And, I was starting to kind of get slapped on the wrist a little bit for, not billing for things that I thought were not really treatment. Do you know what I mean? So I was having those ethical moments and I thought, okay, this is probably a good time for me to leave this now. Right. And then I realized that looking back, I realized that I had a hospital placement on inpatient rehab as a student and how much I actually really enjoyed that. And sure enough, that hospital had a casual position posted. So I took a chance, left the full time for a casual and never actually worked casually. I think I was like maybe a couple months where I was casual. I've been full time ever since, not necessarily permanent full time, but was working full time hours. So it worked out, and really felt more refreshing to be in the clinical space that I think I wanted to be in, not realizing.
Yeah. Tell us
Yeah.
about your work day within this new space. How was that different? How did you manage that time there for yourself?
Um, I think, I think there's stress in every workplace, and I think there's workload in every workplace. I think it's just a matter of, like you said, how do you manage it, and how can you work with that and still, in my opinion, have autonomy. But I just find the workflow, in the mornings, you have like it's a unit of 30 beds, and there's 3 physios, let's say, and every physio has a 10-to-1 ratio for therapists. So every morning, my usual routine is to check the patient's charts, to follow up with the patient, let them know of their therapy times, talk with nursing staff, medical staff to see if there's any changes in statuses or how the patients were feeling. So I really realized how much I thrive on that communication and that collaborative approach to care, which I feel like in my other jobs prior to, I didn't really have that so much. Um, and so that's kind of how the workday flows. And then I start doing patient care after that, more direct patient care. And then at the end of the day, I have time to chart as well. But we're also, I'm also charting during patient care too. I will say I still do like chart through my lunch at times, but for me, it's my compromise is that I'm able to leave work on time and not bring any homework with me or have to chart the next day. Like I'm really big on not doing any late entries. There's certain non-negotiables that I try to keep a boundary for, and those are a couple of them.
Mm. You've been here 10 years. So that sounds like it's hitting that sustainable model for you. So you kind of stayed here a long enough time. So tell us that piece. So did you from the beginning kind of have your other parts? So maybe, your socializing and your fitness priorities, or when did you start to bring them back in if you
Like
didn't start?
my personal priorities. Yeah,
Yeah.
I think honestly, I think I had always kind of had that still, like throughout my other practices too, but I didn't feel as like stressed. So I was also like part of like recreational badminton and softball leagues and things like that. And I find that they both feed off of each other. If you're satisfied in your workplace and you have joy at work, I find that spills over into those personal interests as well, those outlets of creativity. And I also think you find your flow a little bit better too when you really do feel more at peace with your personal and your professional life. I do think that while it's good to kind of keep them somewhat separate, I think that we can't help also but to identify it, as healthcare providers, even in our personal lives as well. It's just who we are, I think. But yeah, I did find that I had more energy overall. I could sustain my energy. I could, work, and then I could go and spend the evening, playing a sport, and still, go to bed, fall asleep, and wake up restored. And I'm still able to do that to this day. I'm a 5 a.m. riser. That's usually the hour that I wake up in. And I mean, during COVID, I will say I kind of fell off track a bit, but I now feel like I've kind of gone back to where I was, over the last several months, when I started at the hospital initially. So yeah,
Yeah.
it's always a process.
Yeah,
It's an
absolutely.
ongoing process. Yeah, for sure.
And workplace wellness, what was this group or thing that you started?
Yeah, so the therapist who had encouraged me to apply to long-term care, it was actually something she had started, and then I just kind of stepped into when she overtook other homes. Then I stepped into the homes that she had started this in. Basically, it was for staff who had sustained like workplace injuries
Mm-hmm.
or injuries in general, and they were requiring physio, and being on site, it was just more convenient, right? So we were still able to offer them the services as well, and it was cool. We got quite a few good outcomes and results for staff, allowing them to get back to work, and again, getting them back to being able to provide the care that they're needing to provide, but also wanting to provide. So that
Mm-hmm.
was quite fulfilling as well. And, now that I think about it, I think that was kind of, one of my interests in sustaining healthcare provider well-being, not realizing it then. But that was, something I was interested in.
Yeah. And what are you doing now? Because it's not just physical therapy now. Tell us
No, it's
about
not.
what else you've fitted into there.
I mean, and this is the thing, like I said, like you kind of mentioned, when you start to find, I think, your place that aligns with you in terms of your work, I find that you can find more time for other things and other outlets that bring you joy as well, more personally. So, my dad struggled with chronic illness from the time I became a physio, and even when I was in school. And I moved back home to help my mom care for him. So we were a family of caregivers, and he passed in 2018. And at that time, I realized that a lot of what I learned clinically and a lot of my clinical experiences were shaped by my personal experiences of being a caregiver to my dad and also witnessing his journey in the healthcare system dealing with the chronic health issues, right? So I ended up writing a book. So I did author a book called Communication is Care, Non-Empowering Strategies to Guide Patient Healing. And that book is, it's a narrative, mainly a personal narrative of my dad's journey and of mine clinically as well, about how to empower patients to have, empowering experiences through communication, and recognizing that in itself is an intervention and is healing as well. So I wanted it to be a quick read. It's only like, people can read it in a couple hours. It's very quick because I know how students and healthcare providers and how busy we can be. So that was kind of the intent of it. And then, so I wrote that, and then I realized, again, a more reflection, I realized, well, maybe I didn't do enough for healthcare providers in recognizing why they may not be communicating as well, and so I then looked at the podcast. I started a podcast called Healthcare Provider Happy Hour, which is about helping healthcare providers to sustain their well-being, and also to ultimately enhance their patient-provider communication. So that's really what it came back to for me, was helping them to better communicate, but also by recognizing that burnout, moral injury, mental illness, physical illness, like that, those things can affect the way we actually communicate with our patients and empower them.
Yeah, that's super important. Yeah, I love that.
Yeah.
Love that you do that, and I love that you give kind of that perspective to help guide, because you're right, there's so many constraints on physicians and clinicians within the models that they find themselves within the healthcare system that is putting pressure on them from all angles. And this time pressure, like what you had experienced in the private clinic, but even within your inpatient population, your 10 patients that you're allocated, your time can be easily eaten up.
Oh, totally. Yeah, totally. Like, I mean, it hasn't been easy. Like, it ebbs and flows in terms of, the time that I have and the time that I don't have. You know what I mean? Like, and I've learned to understand that it goes in waves. And when things are very chaotic, I tell myself that this is a wave that I'm going through, and I do my best to navigate it. But yeah, like I'm not perfect by any means. Like I said, I still chart through my lunch. I sometimes look at other people and I'm like, how are they done their charting? Like, and being a writer, I tend to write a lot, I think, too. So that's just kind of what feels right for me in terms of capturing the patient narrative a lot. That's, I try to do that as best I can, and some providers don't as much. It's just, everyone documents so differently. But yeah, an inpatient unit, like I work on a general unit, so I see like, many different types of patients with different diagnoses. Patients are dealing with more chronic and complex health issues, and we're seeing that more and more. And that's what I love about our approach in terms of it being like an integrated team-based approach. I do find that that's kind of what we're dealing with in today's healthcare system, and in society and community as well. So I'm very lucky to work in that environment. But yeah, I have like hundreds of conversations a day, right, between patients, families, staff. So that's all, depending on the conversation, that can be energy draining or, energy adding, right? So it just depends.
And what about the difference between the conversation you're trying to help the patient understand, part of that effective communication, and you're trying to provide therapy? So we know that the education of patients is going to be or even just helping them get to that understanding is a significant time investment
Mhm.
for you. How do you balance that?
I just keep at it. Like I keep practicing. I keep. I'm not afraid to have courageous conversations with patients. And I think that's just from my experience over the years. And again, like watching my dad go through the system. I really appreciated those providers who were transparent, who had empathy, who could, you knew that they cared. And that they only had, but yeah, they only had so much time or whatever it might have been, right? Like so I do have those conversations with patients, and I try my best to help set them up for success and independence wherever I can. So I find like by doing that, that also overall saves time because patients are satisfied, they're able to work on things outside of therapy that also will help them. But at the same time, we can then focus on what they really want to focus on in therapy as well, where they may still need that support. So I really try to encourage patients to kind of actively participate and kind of guide me through their goal setting, while also, me again, being, having those conversations if objectively the goals are not very realistic or whatnot, like having that conversation with the patient, I think is still important because I guess we are the experts, but patients are the experts over their bodies. And I think it is our role, and I think patients do expect us to be straightforward with them and have those conversations with them because I don't think anybody else will, right? If it's not going to be us, who else is it going to be in terms of our experience and our expertise, right?
Got it. What about those chaotic weeks where you have a lot going on and you know that someone's going to need more time? And so you're going to have to start to be curious about what you do with the other appointments for the day if we want to have any way of reining this into the hours.
Yeah.
How does that happen?
So I mean, we do work with a rehab assistant. So if something is appropriate, I will delegate.
Hmm?
If a patient's appropriate to work with the assistant and vice versa. But also, to me, it's quality over quantity. And I think sometimes, in our setting, patients can get fixed on having an hour of therapy, because they're kind of being told that along the way. But again, I have those conversations early on, and I believe I provide the therapy that patients require. And for some patients, it might be 45 minutes or half an hour, and some can't tolerate an hour, right? So I'm really just trying to tailor that to, again, what the patient can tolerate, the patient's needs. I try to use delegation where I can. Sometimes we'll co-treat as therapists where needed. If the patient requires more physical hands-on assist than I can provide alone, but we know is essential to their overall progression towards their goals. So there's strategies there for sure. And most patients are very understanding. Like I've always said, and again, because I was there on the other side, so I get it. Like patients know we're busy. They sympathize with that. But at the end of the day, what they really want to know is that that when they're with you, that you're genuinely, interested in their experience and that you care and that you want to help them, get to their goals as much as you can, right? So that's really what matters. So time is not as much an issue, I think, in that case, as long as the quality is there.
Yeah. I'm interested that they even had a 1 hour therapy expectation, given
Yeah.
that you're not going to be there for 10 hours. And if you are going to be there for 10 hours, you're not going to be there working for the entire 10 hours. And you also
Right.
have to finish like reading about them,
Yeah.
notating
And
about the
prep.
visit. Like there's a lot going
Yeah.
on here. The
Yeah.
even the that expectation seems unreasonable that the patient would even think it's an hour of therapy.
Yeah.
It's
Yeah.
clearly not.
It's not, and it's not their fault in a way because they're kind of being told that by other, like from the acute care site maybe, because that's the way it used to be in a way. So I just think that things have changed over the past few years. Like I mentioned, complex medical cases and patients being unable to tolerate like an hour even. So yeah, everything is so variable now, and it really is like an everyday assessment of the day, and not everything goes as planned. And I think I've done well at navigating that. It's part of what I love about the job is that it's just so dynamic and different, and I've learned a lot in terms of managing my time and being in those situations for sure.
Yeah, certainly there's a lot of autonomy in your scheduling from the sounds of it about
I try to.
where you put your
Yeah, yeah, exactly. I try to because I think autonomy is important for our sustainability as healthcare providers is feeling that sense of autonomy. So where I can implement it, I will. So
yeah.
yeah, as long as our patients are getting the care they need.
Yeah. And where do people find you if they're wanting to listen in at what you're talking about in your podcast and other things that you offer?
Yeah, so my website is pretty much like where the hub is. It's jennifergeorge.co. You can sign up to my newsletters there as well. I put out newsletters every now and then on a Tuesday usually. And my podcast is usually released now bi-weekly. So the podcast link is on there as well, or you could listen to it on any preferred player. And there's a link to the book as well from there too, I think, to Amazon. So yeah.
And what's your podcast called?
The Healthcare Provider Happy Hour.
Perfect. The Healthcare Provider Happy Hour. Is there anything we didn't talk about that you would like to kind of help our listeners understand if they're in this place where they're having, difficulty figuring out their personal priorities or that ability to communicate effectively with their patients? Yeah.
Yeah, I mean, I think it's important to just reflect on it. I think, if it doesn't feel right and it's kind of been going on for a long time, it's something to check in with. And if you're having difficulty managing stress, understand too that it's not completely all on you. Have the conversations, with your team, with your supervisor, see if there's something that can be done to help with that at a workload level. As well, because there are some inefficiencies sometimes in the system itself, and it's not just all on us, but definitely a lot of it is. And I think it's important to also be true to who you are as a healthcare provider, and also find the things that bring you joy. Because again, when it comes to like energy draining and energy adding, things that bring you joy, outlets that bring you joy, even though it's more time, it'll still, actually add to your reserve in the end. So I think that's important as well.
Yeah, that's super important. Yeah, I love that. Perfect.
Thank you.
All right. Well, thank you so much for being here. I really enjoyed this conversation with you and about your journey through physical therapy and the communication piece. So thanks so much.
Thank you so much for having me, Sarah. And thank you for all you're doing.
Perfect. All right, everybody. You have a workshop coming up. Stop hating clinic days. This is my jam. I love helping you with your clinical days and your clinical day efficiency and looking after you within your clinical day. No one else will respect your time. This is all about you and how you work within your clinical day, giving you some strategies for how to manage the task load of the day, improve your workflow, consider other ways to help you within the clinical day. Make sure you sign up for the workshop. It's available right now to register, and we will see you there. This will be interactive, give you some strategies to have that you can put into place immediately, some ideas for bigger systems and processes, and some longer term priorities for yourself. Join us then. I will see you there. Looking forward to it. Bye, guys. Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.